Hi, let's talk about IV access. Before I dive in, I want to clarify terms. A catheter is a long, flexible tube. Note that the word catheter and cannula can be used interchangeably. Back home, what we know as IV access is cannula. That's what we call it. And that is the device that you insert in a peripheral vein to gain access to your patient's vascular system. So that's what we are familiar with. That's what most of us know as IV access. But over here, there is a wide variety of options for gaining access, gaining IV access. There are two main types though, central and peripheral. Now, the peripheral is the one we are more familiar with. It stays in for 3 to 4 days. Every nurse is trained to insert it, but then it has limitations, and those limitations are there are some medications that you can't send in through there. So medications that are vesicants that can destroy smaller veins, such as levofed, and other medications that have very low pH or very high pH also fall into that category. So that's the limitation of peripheral IVs, or PIV for short. Now, central lines, there are two main types. That's the central venous catheter, that's CVC, or and the peripherally inserted central catheter. So just as the name implies, it is a central catheter, but it is inserted peripherally. So you find that they insert it from the veins on the upper arm here and send it right through to a central vein. So that is PIC, the peripheral inserted central catheters. Now, the CVC, that's the central venous catheter, they are inserted directly into a central vein, so a big vein. So you find that in the neck, chest, and groin. That's through the femoral vein. So those are the main places where those ones go in. And they have the advantage, that's the central lines as a whole now, both PIC and CVC have the advantage of accommodating large volumes of fluid and vesicant medications, which the PIVs are not able to do, or is risky to do that through them. The PIVs, like I said, stays for 3 to 4 days, but these ones stay longer. Like the PIC can stay in for like weeks to months, even up to 3 months. For the CVC depends on the function. There are different types of CVC. There are different types. Some of them stay for weeks, some for months, even for years. So it all depends on what it is designed to do. So we'll touch on that a little later. I want to talk about midlines. Midlines, they don't fall into any of the categories. It is not a central line, and you cannot strictly say it's a peripheral line, even though in the sense of what kind of vein it goes to, it can be called a peripheral line, but it has a longer duration. It's more durable than the regular PIV we know. So the midline also is inserted in the bigger veins. They are not central veins, take note. They are peripheral veins, but they are bigger on the upper arm over here, maybe the brachial vein or basilic vein or cephalic vein. So they put them on the upper arm here. They don't go right in, they stop somewhere around here. So that's it for the midlines, and they stay in for 4 weeks. They can stay in for 4 weeks. So that is it. Then I want to touch on two types of CVCs, that's central venous catheters. One is the implanted port. This implanted port is made up of two parts. It has a port and that port is connected to a catheter. So that port is implanted under the skin. It's a surgical implantation under the skin, and then it is attached to a catheter which goes straight into a big vein or the heart. So that's what makes it a central venous catheter. But it is designed to stay for a very long time, even up to a year or years. And mostly is used for long-term treatments like chemotherapy and prolonged antibiotics treatments and the like that will stay for a very long time. So that's implanted port. You find if you see it, sometimes it's circular or oval or triangular. You can see it under the patient's skin or on top this place here. Then there is the vascular access catheter. It is also a CVC, but this one stays for a shorter time and it is used for, is a temporary dialysis catheter. They sometimes call it VASCATH. It can stay for up to 45 days and it's temporary for dialysis. Now, let me just run through the basic things. There is policy, depends on the policy of you, wherever you work. They will tell you what to mess with, what to clean, or as in their rules, there are clear instructions on which of this kind of access you can work on or not work on. So, but basically what is done is changing the dressing on it because there's a dressing on it. So change it. The midline and the peak, it's weekly that it is changed. So just go by your company's policy. Then you also check the site for infiltration, infection. You should flush it depending on your policy also. Sometimes they use saline flush. Some other facilities may use a heparin flush like this. So this is a saline flush. So depending on whatever it is that you use in your facility, you go ahead and use it. I'll stop here. Thanks for listening. Make sure to like, share, subscribe, and follow for more.